My name's Christina Hildebrand. I'm from A Voice for Choice, which is an organization that advocates for people to have informed choice and transparency of anything that goes into their body. I too am here to speak about vaccinations and the role that doctors have in writing medical exemptions. When you talk about vaccines, especially to doctors and many doctors, it's a taboo subject as a consumer, as a patient. But it's something that, most doctors will say they're safe and effective, but they're not 100% safe and effective. And there are children and adults who do get injured by these vaccines. Unfortunately, there's no way of telling or explicitly telling which child is at risk or which adult is at risk and which one is not from the vaccines. The vaccine schedule that the CDC has, the 72 doses by the age of 18, has never been tested in its entirety to see whether it is completely safe. I see two issues here that I would like you and I ask you to look at. One of them is that the insurance companies are giving kickbacks to doctors to have their children that are under age 2 or by age 2 fully vaccinated. There is up to $400, maybe even more, being given for every child that is vaccinated fully, which means that doctors are not looking at whether a child, what the risk and the benefit is. They're looking at their bottom line. $400 is a very nice amount per child under the age of, or who gets to 2 and is fully vaccinated. So I'd like you to look at the Stark Act and the kickbacks that those doctors are getting for fully vaccinating their children, and whether they truly are looking at the risks and the benefits for each and every child. The other thing that I see is that there is no recourse for patients who do get injured, not severely injured, but just have a seizure or have some reaction to a vaccine, because under the Vaccine Compensation Act, you have to have had an anaphylactic shock or have died from the vaccine to go to that program and request for monetary compensation.
Please conclude.
I will. So the other piece of it is that there are many doctors' practices that are now throwing children out of their practice because they are not 100% vaccinated, which again, if you're looking at each and every child and looking at the risk and the benefit of a vaccine for that child, you need to have a doctor allow children in there that are not 100% vaccinated. And that comes from either the corporations that they're working for, such as Kaiser or Stanford or other larger corporations having a say of you must have vaccinated children, or from the insurance companies. And what that leaves you with is a very few number of doctors who are in private practice, don't take insurance, who are willing to look at these children holistically. So I ask you to do those two things. Number one, to look and investigate the kickbacks that doctors are getting. And number two, really look at whether the doctors are doing no harm by having the children 100% vaccinated in their practice, because 100% of children should not be vaccinated. Thank you.
Thank you, Mr. Hildebrand.
As I spoke to you yesterday regarding SB277 and the medical exemptions and how doctors are being incentivized for fully vaccinating children up until the age of 2 and the kickbacks that they're getting, and I asked you to look into that. And what I realized was it's really a broader issue, that the doctors are getting kickbacks from a number of for doing a number of different processes. It can be various surgeries they recommend, or the one that we're interested in is the vaccination policy, but or the vaccination piece of it. But I do ask that you look into that fully and look at whether doctors are really doing what they should be doing, because they're getting money incentivized back. The piece that I wanted to talk about today was specifically the medical exemption pilot program that has been put on by the Santa Barbara County public health director there, Charity Dean, and Dr. Wana. And it has also been copied in Sacramento County and Marin County. And our concern there is that they are collecting the medical records, the medical exemptions from all the schools and looking at them. And there was a meeting, a teleconference on May 13th, which the California Medical Board attended, to identify suspicious medical exemptions and how to report those suspicious doctors. And my concern there is SB277 in the law states, and specific to Governor Brown's signing statement, said that it was at the discretion of the doctor to give those medical exemptions. as I mentioned yesterday, you know, vaccines are claimed to be safe and effective. They are not 100% safe and effective. If you just read the package insert, as with any drug, they're not 100% safe and effective. And so there are doctors that are using the latest research, some of it you heard yesterday, and are doing evaluations really truly on the risk to benefit ratio of vaccines for an individual, not on a mass scale. And those doctors are giving some of those doctors are giving medical exemptions when it's appropriate. But I would ask you to please call off the witch hunt on those doctors who are giving medical exemptions. They're good doctors, and they're giving them legally and legitimately, and they are doing the ones that we're aware of. They're doing their piece to help these children. So I would just ask you to please call off the witch hunt, and really, if you're looking at doctors that don't give the full schedule of vaccines, to understand that there needs to be those doctors out there for our children and for people who can be more susceptible to vaccines, not based on the CDC contraindications, but based on their family history. So, for example, if a child's sibling has had a seizure or has died from a vaccine injury, that sibling is considered in getting getting a medical exemption. So that is my ask for today. Thank you.
Thank you. Thank you, Mr. Hildebrand.